Good morning. My name is Michał Mazur. I am the project manager and accessibility coordinator at the Ministry of Health in the Republic of Poland. I want to tell you about digital accessibility to healthcare in Poland. And first, what is digital exclusion? Digital exclusion is a phenomenon of social inequality between individuals, households, companies, and regions in the level of socio-economic development related both to access to information and communication technologies and their use in all spheres of activity, according to the Orange Foundation report, Socio-Digital Exclusion in Poland. And what's the types of digital exclusion? For the first, exclusion due to access. It's accessibility, lack of access to devices, software, network, access services due to their physical inaccessibility and lack of access to them at a level that ensure for freedom of use. For example, lack of connection with adequate speed or stability of services. And inability to buy them due to the costs. And what's the reasons for accessibility exclusion? The reason for accessibility exclusion may be economic or geographic, lack of infrastructure in a place or region. They may also result from the lack of adaptation of devices and or software to the specific needs of specific users, such as people with disabilities or seniors. And the second types of exclusion based on the used. Exclusion by competence, the inability to acquire, maintain, or update ICT-related skills. Exclusion by methods of use, related to the extent to which technology is used for the various purposes it can serve in the information society. And exclusion by motivation refers to mental barriers. It refers to the lack of motivation and willingness to get introduced to modern technologies, lack of self-confidence, fear of innovation, but also risks connected with the use of new technologies. In Poland, we can talk about socio-digital exclusion. It's the phenomenon of permanent structural limitation of life chance of individuals and local communities as a result of mutual overlapping and reinforcement of social and economic disadvantages and the deficits connected with the ability to use digital services. The link between digital exclusion and social exclusion is close, becoming stronger over time. In the impact of digital inequalities and social inequalities, we speak of a vicious circle of inequalities. It's a feedback loop, leading to a growing increase in both the one and the other. Social digital exclusion. Why should it be addressed? The new technologies are losing their status as one of many tools for social inclusion and are becoming a primary tool. Their availability and use determines our chances of maintaining job, income, purchasing services, accessing to healthcare, accessing information, enjoying culture, development, and education, maintaining social relationships too. In the long term, those who cannot use these tools are at a risk of marginalization to an even greater extent. The dimension of digital exclusion in Poland. A report by the Orange Foundation says that in 2020, 81% of Poles use the internet and at least once a week. 90% of households have access to the internet. The groups most digitally excluded today are the elderly, to a lower extent people with low levels of education, and people with poor financial situation. Digital exclusion is also quite clearly correlated with professional inactivity. More than half of those who have never used the network live in Poland in a rural area. The key form of digital exclusion that determines non-use of the internet remains incentive exclusion. It is lack of motivation. The incentive exclusion, lack of motivation, is based on a low level of self-awareness of needs related to important things in the lives of individuals that can be satisfied through the network, and a lack of knowledge of what the internet can be used for. The relationships between digital exclusion and inclusion and social inclusion and exclusion is determined in large part by how we use digital devices. The reduction of inequalities related to social activity, educational opportunities, labor market situation, civic participation, access to healthcare, or ways of enjoying culture is possible when we are able to use digital tools and services connected to these areas. And what is the groups at risk of digital divide in Poland? It's the elderly, people with low levels of education, especially those of working age, potentially with special emphasis on those aged 25, 33, people with the lowest level of income, people living in peripheral, rural areas, single-parent families, families with many children, children of primary and early school age, people with disabilities, and people on crisis on homelessness. And very important is that one person may be at risk of exclusion to the several reasons. People with disabilities as a group at risk of digital divide. An important form of effort for this group is to promote and to monitor the accessibility of websites and services, especially for visually impaired people. Maybe you can hear about WCAG standard. Adapting online content to their specific needs also means, in most cases, adapting to the sensory capabilities of seniors, for example. The Act on Digital Accessibility of Websites and Mobile Applications on Public Entities serve this goal. It's the Act of 4th April 2019. And what is digital accessibility? Digital accessibility is one of the features that digital solutions should have in order to make them usable by the largest possible group of users. Digital accessibility means that websites and mobile applications can be used comfortably by people with various disabilities, vision, hearing, movement, but also intellectual disabilities or cognitive impairments. I want to tell you about second important Polish act, Polish Accessibility Act of 19th of July 2019. The Act of July of ensuring accessibility for persons with special needs. The aim of the law is to improve the living condition and functionality of people with special needs who are at risk of marginalization or discrimination due to, for instance, disability or reduced level of ability due to age or illness. This act is key element of the government Accessibility Plus program adopted on 17th July 2018. The solutions provided by the law implemented the provisions of the United Nations Conventions of the Rights of Persons with Disabilities, which obliges to ensure that such persons have equal access to various facilities with other citizens. Ensuring digital accessibility serves to counteract digital exclusion of vulnerable people. Lack of solutions to provide digital accessibility of healthcare institutions means increases inequality in access to healthcare. But a higher level of digital accessibility improves the chances of using healthcare institutions by people at risk of digital exclusion. For instance, people with disabilities, the elderly. And I want to tell you about our project, the project Accessibility Plus for Health. The project is implemented under the program Knowledge Education Development, co-financed by European funds. The aim of the project is to implement quality measures to adapt healthcare institutions to the needs of patients with special needs, including people with disabilities and seniors, based on the accessibility standards. The implemented solutions contribute to improving the accessibility of medical facilities in the following areas: architectural, digital, including telemedicine, and information and communication. The project is implemented in hospitals and primary care facilities. And what is the results of project Accessibility Plus for Health? It's 4 calls for hospitals and primary care facilities, more than 340 contracts signed with hospitals and primary care facilities, 270 primary care facilities and 77 hospitals have implemented measures to increase their accessibility for people with special needs, including digital accessibility. And more than 1,100 employees of primary care facilities and hospitals, for example, nurses, registration staff, and doctors, participate in training on communication with people with special needs. And I want to show you some examples of implemented solution thanks to our project. On this picture, you can see the tablet with special software speakers. This software helps not only in working with children, they are often used to communicate with adults, with, for example, after a stroke or with neurological speech problems. And the second one example is website with medical appointment function. The third one is a registration system developed in a project. And I want to tell about other solutions for digital accessibility. On October 2024, the Polish Ministry of Health has launched the first contact teleplatform, thanks to which the patient can receive a professional medical assistance in the form of teleconsultation and a prescription, a referral, or a medical leave within the primary healthcare outside office hours, on holidays and weekends. And on February 2022, we have launched a signed language interpreter services on the platform. It allows hearing impaired people to receive medical advice on the first contact platform. I cooperate with the European Commission as a national jury and on contest Access City Award 2024. And I want to show you 3 simple examples from Polish cities, examples for digital accessibility. And first one is the Naprawmy to. Let's fix it. It's a service that allows city residents, including people with disabilities, to report a problem through a website or application installed on a smartphone. This system operates in many Polish cities and helps report problems, for example, in a public space, also by people with disabilities. And a second solution from Polish city is sign language interpreter. It assists deaf people in resolving issues in city institutions in Gliwice. But this solution is more often used by Polish healthcare institutions, hospitals, and primary care facilities. That's all. Thank you for your attention. And if you have any question, please write to me by my email. Thank you very much and goodbye.